a very important role of instrument in our research is through validation, particularly with content validity, face validity, and its criterion validity. So there are actually a lot of validity. Um, there are actually lots of ways that we can validate, no, our instrument, and most of the topics would somehow keep on repeating again and again for every lessons that we will be encountering now, no, because it goes into that kind of process or standardized procedure. Okay. So let's talk about validity and the aspect of self-evident measures. So when we talk about this, it's more into understanding validity in nursing research and also its importance. There are actually different types. No, we have validity such as the content, the construct, criterion, and face validity. We'll be talking this one in the upcoming slides. And we're going to focus more into the computation of item content validity for your CBI and also your ICDI, which is your index, content validity index, and your SCBI, which is scale content validity index. Okay. So later on, I'll be showing some computations, no, for you to do that if you are doing it with a researcher-made instrument, no? So if you haven't had any instrument, what is an instrument? Katubitaw ng tool, no? Kabaw na mo sa na, I already emphasized that katong questionnaire. Now, it should be standardized because if it's not standardized, say for example, it's a researcher-made tool, then we are going through with the process of your CBI, SCBI, and ICBI computation. Okay. However, it's just very easy and how to do it. No, we just need to have a specific template, and we just have to make sure that the computation is right following the different procedure or process. So when we talk about validity, it refers to the degree to which an instrument measures what is supposed to be measured. So when we talk about this one, each item is validated. So it's being checked. The parametric scaling is also being checked in the instrument of an expert. There should be an expert who would be considering the review process, no, or the one who is an expert in the field of nursing. Because basically, what we're doing is in the for the field of nursing. No, we want to contribute in the field of nursing. So therefore, the one who would be measuring or one who will be validating are the experts in the field. If you are in another, say for example, a different expert in the field of business administration, it should be someone who is expert in that field of business administration. So this ensures the accuracy and reliability of research findings. Because somehow, if we are going to use instruments, no, for quantitative study, this would somehow produce a certain result based on the accuracy and reliability of our research. Without the instrument and questionnaire, of course, we couldn't generate data because we did not have any data collection coming from the instrument. Okay. So we also have construct validity, content validity criterion, and even face validity. So first is content validity. So what does it mean? So this ensures the instrument covers all relevant aspects of the concept, particularly critical in developing nursing assessment. So a very good example is when we're trying to validate a new patient care protocol, which we are ensuring comprehensive coverage of a health survey. So what we are doing right now is to make sure that the content would somehow be relevant on what you're studying. So say for example, in this good example that I'm sharing, no, particularly with health survey in the hospital for our patients in the OPD, the content or the item stipulated in the questionnaire should be relevant. And the validator should somehow consider, no, that the contents are valid and somehow effective and also efficient when we are going to see for the upcoming treatment. Okay, so that's how they try to consider that. So there are times now when we're going to give a tool to the expert, no? Because when the expert try to evaluate our tool, it's not just about saying na, ay, bati ni siya, or this is actually right, this is not correct, or this is wrong, no? However, they have a certain tool. I'll also show a very good example of a tool that they'll be using in terms of content validation. Next is your construct validity. When we talk about construct validity, this has something to do with the measurement on how a test or tool identify the critical construct it is intended to measure. So this ensures critical soundness in nursing research. So when we talk about construct validity, how it is well constructed, how it is well organized. And that structure should be anchored with certain theories and, of course, evidence-based practice research. No? What do I mean by that? In making an item, it should not be an item which is out of the box. No, it has something to do which is related no, to the topic as well. And when it's being constructed, there should be proper grammar and also proper construction of sentences. Okay, so the expert evaluators will be looking at that as well. So, say for example, in the nursing research, we're talking about the anxiety levels of our patient, no, and assesses the effectiveness of a nursing intervention. So, in this way, we can somehow the experts can somehow say that if it's more into the research of anxiety levels, constructs must be the same thing, no, or same thought of patient anxiety topics. Okay. At the same time, it should be validated with certain theories. No, meaning if you're going to make an item, it's not just on your own, but it should be anchored with certain literatures and book, particularly with a theoretical construct. Okay. Because there are some students who are making items, no, for researcher-made instrument in a way that it is just in their own perception or their own assumption. It would be best if we can somehow consider, no, topics found in the books, no, or we can anchor certain instrument or questionnaire coming from other authors. Pwede po na siya. Okay? However, you have to make sure to cite your references as part of your appendices, no? Next is your criterion validity. Somehow determines how well one measure predicts an outcome based on another measure. It is important for validating diagnostic tools in nursing. So in this way, a very good example is we're trying to predict patient outcome based on early symptoms and at the same time validating a new diagnostic test against an established one. So when we talk about criterion validity, when we are looking into the item, we already know what will happen to the study. So in that way, it also shows a very good idea for the expert or expert evaluators to know that this particular study has to come along with the certain topic. No, meaning meaning they can somehow predict na at the end of the research, this what will happen to the study. So if that is the case, no, if the evaluators can somehow identify that during validation, that would somehow be included as an additional point, no, in terms of considering it as a valid tool for your research. Because there is some point that um students would somehow make, say, for example, items which is not really relevant, or somehow you couldn't somehow tell if this would really be the answers of the respondents, no? There might come a time that if it is being run with statistical data, say for example, getting the Cronbach alpha, no, it seems like that it is slow due to the fact that respondents, if you're going to do pilot testing, no, doesn't know what really would happen or would somehow relate to the topic that you are doing or to what you're studying. No, so that's more into the criterion validity. And praise validity has something to do with the extent to which a test appears effective in terms of its stated aims. So this ensures clarity and acceptance among stakeholders. So looking into the evaluation of the experts, when they try to see that the item is well furnished and at the same time it has good construct, it is well presented in a manner which is really organized and systematic, then this can be a great add-on point, no, for the evaluators who are evaluating your instrument. Okay. What do I mean by evaluators, guys? Meaning these evaluators are expert on the field, as mentioned earlier. You know? So if you're doing your own instrument, you're going to pay with the evaluators. You're going to pay a monetary amount to the evaluators because these are experts. We're consuming some of their time just to evaluate your instrument. Meaning to say, paying them with the amount would somehow it's somehow a token, no, of appreciation that they were able to contribute as well with the evaluation of your questionnaire or tool or instrument. Okay. For face validity, a very good example is the designing a patient satisfaction survey. No, We happen to know that when we give satisfaction survey to our patient, it has something to do with going into the level of the patient. No, so part of face validity is the translation of the item or questionnaire into the extent that it appears more effective to them. No, in terms of the clarity, there are some patients, no, who couldn't even understand English. So, so through face validation, we can somehow determine that it is clear for our stakeholders or to our patients, no, if they are your respondents. Okay. But of course, if your respondents are professional or even students, of course, they can understand English. No need for you to translate. Another thing is developing an educational material for patients. We happen to know when we try to have educational materials for patients, it should be well translated into vernacular. So an index content validity has something to do with the proportion of experts who rate an item as relevant. So it would depend, no? So say for example, there are five raters. You can afford to pay at least one rater or evaluator for 2,000 and you go for five evaluators. So you spend almost 10,000 as a group for the evaluator to do that. Okay. This has to be considered because each rater has an impact to the scoring. Later on, I'll be showing you the computation. It's just very easy. No, you just have to consider the template. And this is actually being calculated as the number of experts rating an item as relevant divided by the total number of experts. So the relevance is the scoring from 1 to 4, 4 as the highest, 1 as the lowest, and the number of raters, which is around 5. So you have to do your math by doing averaging. Later on, I'll be showing example. So a very good example is that they try to evaluate the relevance of individual items in a new nursing assessment tool. No, so looking at the tool of nursing student, no, in terms of assessment, particularly with with the performance of the nursing student, they're trying to check, no, if this particular item will somehow be relevant or not. Another thing is your scale content validity index. This has something to do with the proportion of items on an instrument that achieve a high relevance rating. And it's being calculated as the average of the ICDI score for all items. So what does this mean? No, this is the last part of the computation wherein the total score or the total computation would somehow be the basis if the questionnaire is acceptable or not through quantifiable measure or through averaging measures or computation. So say for example, if the result is more than zero point 0.6 and above or until 1, 0.6 to 1 flat, no? Flat 1, that means to say that this particular structure of the item is acceptable. But if the computation is zero point 0.5 or zero point 0.4, no, tendency is we might not be able to consider that and we might have to change the item. And once the item is changed, then again, it will be validated by the experts again. Or much better if you're going to delete it if necessary, no? A very good example for this is ensuring the overall relevance of a new nursing scale. So when we talk about nursing scale of the performance, that's at the end, no, that you're going to grade the performance of the student. So basically that will be a basis, no? If the instrument is really valid and it's really well evaluated by the evaluators, then a scale, no, is being provided in order for us to determine if it fits into the measure. So steps, we have to identify the experts who will evaluate the items. No, we've mentioned earlier that it should be it can be one or it can be more than that. It can be up until 9 experts who can evaluate the items. But for me, if you're going to ask me, three is enough. 3 to 4 siguro would be enough. And have each expert rate the relevance of each item. So I'll be also giving you an example on what particular tool that you'll be using, no? And calculate the proportion of experts rating each item as relevant. That's a computation part. So validating a new nursing survey item by item is being measured for the application, which is our example. And for the ICBI, compute ICBI for each item, calculate the average of ICBI score, and this is something to do with the overall relevance of a new nursing scale by averaging item scores. So this is a very good example of a questionnaire. No, the questionnaire, if I am the researcher and I would like to study how clinical instructor impacts my performance as a student nurse. So say for example, I was able to create 10 items, but looking at the example right now, it only shows 4. Now, with these items that are being presented, it is very important that there should be an instructor to the evaluators. So they are also being guided with certain legends. So say, for example, 1 has not no relevance and 4 has the highest relevance, no? So with each item found in my questionnaire that I would like them to validate, it has something to do, no, with the scale. When you talk about the scale, unsa gani na siya, this is a very good example of a scale. Kani siya, no? That is your Likert scale. 1, 2, 3, 4. So if I am the evaluator and I can see that the number one item, what is the number one item? Kani siya, no? States that clinical instructor helps a student who is having trouble with the work. So for me, if I am the evaluator, construction-wise, face validity check, criteria, talking about instructors, help for students on how to improve performance. I believe that this is good. I'll consider that. Criterion wise, it seems that I can predict, no, as an evaluator, na it could come along with the study. So I'll rate this one as 4 because it's really relevant to his or her study. Okay. So for this one, no, it's really subjective because the evaluator is the one who will be evaluating it, no? There is no, however, it's being measured through scaling based on the grade, no? So it's still one, it still has, it's still equal. Second, so for example, I'm the evaluator. I thought that I receive adequate attention for learning. Yes, it can be, no, because having adequate attention for learning is very important on what the clinical instructor should do if they can see that the performance of the student is not doing well. Face validity, good construction of sentence, and it seems like that for the upcoming treatment of the data, there's nothing wrong with this one. So for me, I'll score it with 4 still. Na, no? And of course, you have to have them affix their complete name and also their signature because part of the content validation of your study should be appended in your research book. No, hindi mo siya ilabay, guys, because you're actually paying that much to the evaluator. It's really a good evidence, no? So that the panelists would say, so did you do validation of your instrument? How do you know that your instrument are well validated? Knowing that you guys are the ones who's making it. Doc, I just would like to tell you that we already have content validation coming from the experts. And it shows that in our computation, it has a high relevance of our content validity index for index and scale. So mga nga jud ang panelist ng imong ingon na sakto di ay ako rin wala ni tanaw sa appendix, no? Sa appendices na adi mag-stipulate dito. So that's a good evidence. So the total number of experts and its implication on the acceptable cutoff score of content validity index has something to do with 2 experts. The score must be 0.80. If there are 3 to 5 experts, the acceptable CDI value is 1. So it's really perfect, no? So if it's at least 6 experts, 5 to 6 siguro, it's 0.83. These are according to books of Davis, Pollitt, and Beck and Lin, no? And 6 to 8 expert, 0.83. And with 9 expert, it's 0.78. But if I'm going to consider, no, which one would be the in best value who will be evaluating the content validation of my instrument, I'll go for the second row, which is 3 to 5 expert, no? I'll go for the perfect one, okay? Because say for example, I can get only 0.8 because of 2 expert tendency is lisod na siya mabawi. Okay, so if there are also a lot, at least 3 heads who will be evaluating, if they can get a score of 1, much better because for me it would be well validated and probably with the statistical running of the Cranbach alpha, it can be it can somehow produce no a good statistical value, right? So this is a very good example, no? So we have four items. No, asa gani nakuha na to ang four items? Kani, na siya diri. 1, 2, 3, 4. Next, for the rater 1, 2, 3, 4, 5. I'll go for 5 expert for the second call, for the second row. And then the number of agreement. How did I get 5? How did I get 3? I say 5 because with a number of rater, if the rater is rating it with 3 and 4, that's 1 point. Okay? So item number 1, 4, 1 point. Rater number 2, 4, again 1 point. Rater number 3, 4, 5. 4 and 5 is 4. So if you're going to add 1, 2, 3, 4, 5, the number of agreement is 5. Meaning to say that item number 1 is really solid because everyone really identified it as valid. Another example, item number 3, 1 is rating with 4 and 4. So that's 2 points. 2, is it 1 point? Is it a point? If it's 1, if the rating is 1 and the rating is 2, it is not considered as a point. Okay? So how many points do we have for item 3? Pila man? Hello? Pila? Uy, nangatug na ba ang tanan? Okay, 4, 1, 2, 3. Tulo ka 4. So your score for number of agreement is 3. Did you get it, guys? I need a response. Nakuha ra or na ay kalipkan? Kuha ra? Okay, 1, 2, 3, 4, 5. Okay. All right. So 1, 2, 3. So how do we get right now the ICDI? So when we talk about ICDI, 5 has an equivalency of 1. If it's 5 again, it has an equivalency of 1. For 3, nga naman na siya, 3 divided by 5. So muna nakuha mo ang 0.6. Okay? And 5 divided by 5 is 1. So the total of your ICVI, no, divided by 4 is your average SCVI, your scale content validity index. That is why it's 0.9. For the total agreement, why 3? Because there are only out of the 4 items, the score of 5 is only 3. 1, 2, 3. Okay? And how do I get the SCDI slash your UA or Universal Agreement? It's 0.75, 3 divided by 4 items. 1, 2, 3, 4. That's 0.75. Now, as mentioned earlier, if the total SCDI and also the total SCDI average of your Universal Agreement and also the average, no, is greater than zero point 0.6, can we consider that the 4 items are valid? Yes, we can, no? We can consider it as valid because again, if the amount is greater than 0.6 and above to 1, that means to say that we can proceed with these items, okay? And then if you can also evaluate 0.6 for item 3, considering your ICDI or your item content validity index, 0.6 is also a good number or value, no? So nothing to worry about unless the value is less than 0.6. Probably we can delete number 3. But 0.6, it's not perfect, right? We can somehow focus more into the enhancement of item number 3. Perhaps with the one here, for the evaluators tool, they can provide certain comments and recommendation if they could, no? So for this scale, probably in the bottom part, before they affix their signature over printed name, probably a suggestion lines will be provided for them to suggest if there are needed. No. Okay, so focus sila din sa 0.6. Ikaw di ay. Okay? So probably, ibutan niya dito, dili kay nindot ang pagka-construct sa sentence, no? Mo yun ang usap. Nindot na ni man siya. It's actually good, but you really have to do better, no? By making sure to be to be more specific rather than generalizing items. Na, okay? And always be guided with a legend, of course, for you to be guided as well. So, question so far. I hope if you have a researcher-made tool, wala pa dyan yung approach na ko about researcher-made tool. My question is, were you able to do validation of your research instrument or questionnaire? Or basi nagkuha lang ka sa internet, nag-use ng kag-chat GPT, no? Dapat ma-validate siya. And right after this is the one that you're going to pilot test. Mani mong ipadali dito sa 20 kabuk participants or 10 to 20 participants to answer your questionnaire or your tool. No? So that 10 to 20 participants are not anymore included if you are going to rerun again the instrument. Pilot lang man siya, you're just testing it, no? You're just selecting randomly at least 10 to 20 as part of your population who will be answering your tool after it is contently validated. And once done, tali na mo siya, run it with statistics, no, with your statistician, and you are able to get the Cronbach alpha. The Cronbach alpha is a type of number in which if it reach or be equal to zero point 0.6 and above after running in statistical treatment with your SPSS application, that means to say that it's valid. No, so it's really reliable. That means to say that validity and reliability would come together in statistics for your instrument or questionnaire. Sir, what if the content validation did pass, but the Cronbach alpha failed? What are we going to do? Which one are we going to consider? We have to consider both. Okay. We have to consider, no, if it has a low alpha Cronbach alpha less than zero point 0.6, for example 0.4, kunya na evaluate na sa mga experts o really a good rating, no, na it's really relevant, you really have to change it, or probably I suggest you have to delete it. That is why if you're going to make some items, at least more than 10, because out of the 10, we don't know if out of the 10, it would somehow produce a good result after statistical treatment. Okay? So, ingon ana, today na siya, sir, di siya pwede na, we're just doing the instrument and we're doing it and we're going to collect the data directly. No, no. It should go with validation and reliability testing. And those output will be appended in your appendices, and you're going to discuss this one in your instrumentation. Okay? Which part of your book are you going to discuss this one? It should be in the research instrumentation. Okay? See, question so far? So another example is your survey instrument validation rating. So you can give this one note to your evaluator. 5 strongly agree, 1 strongly disagree. No, so the items in the instrument are relevant, blah 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 blah. And then once you tally it, we need to have it run with statistics with a statistician. Okay, pwede ra po ng statistician. All right, but you can also use this one, guys, for the computation manually. But that manual computation can be run in SPSS. Pwede na po siya para dali na. There are students, if you don't want to pay a lot for your statistician, then you can do it on your own. This is another example of a good validation rating scale. So we have to engage with subject matter experts, of course, those statisticians, no, and also with evaluators. Do pilot testing with instrument. As mentioned earlier, you happen to know what pilot testing is all about. It's actually a tedious process, but in the end, if you will be able to come up with an instrument, it would really give you a relief and you're ready to collect your data or do data gathering, provided that you're done with your ethics, no, with your IRB, and use established validity measures. And we have to implement a new patient assessment tool with proven validity as part of our application of our example. No? So kung maghimo-himo ka, if you're a nurse supervisor, you also have to do your pilot testing and you also have to consider as well validation. Because if you will become a nurse, research is also there, no? Dili mawatch yun ang research, especially that if you are in a managerial or supervisory level, what we usually look into in our perspective as a supervisor and manager in the hospital is the quantifiable measures. What do I mean about it? Quantifiable, because if you're going to present to your boss, say for example, to the president, vice president for operations, they're not more into quality, no? They're more into quantity. They want numbers. And what that numbers are saying is really part of your tool run to statistics and your best skill in research interpretation of the results. Okay? So wherever you go, research is always there, not just in the academia. So just to summarize, we've reviewed various types of validity, and we happen to know how to compute your ICBI and also your SCBI, and of course, how to validate no questionnaires as part of our research. Questions so far? Ala, wala na. Kana ni in karon ha nga pag-upa kay ako na nagtanawon kung ano na ingon ana. Okay? Sige. So if no questions and concerns, let's proceed to session number 7. So we're talking about pragmatic measures of validity and construct validity. So in this lesson, trying to understand what pragmatic measures of validity and construct validity in nursing research. And we're trying to explore pragmatic and construct validity. And of course, focus on describing pragmatic measures of validity and construct validity. So what is the definition of your pragmatic measure? This is somehow assesses the practical utility and relevance of research instrument. When you say practical utilization, it's relevant. And when you talk about relevance of the research instrument, it has something to do with topics that are really related. The relatedness of each item, no, towards the participant and also with the study of the variables. This ensures the tools used in nursing research are effective and applicable in real world setting. That means to say that we are doing this because it has a practical value of the study. It is a contribution with the nursing profession. Okay? It actually boils down as to why we're doing research in nursing. Because of course, we want to contribute knowledge, values, beliefs, practices in our profession in a way that a novice nurse is doing. Okay, because of course, nursing students are considered novice, and you're in the expertise field of nursing. Example in nursing research, we assess the practicality of a new patient assessment tool as part of considering its practicality for our patient, no, their experience, validating the usability of a nursing care protocol as well. So, in predictive validity has something to do with how well we measure the instrument which predicts future outcomes. So, say for example, we're predicting patient recovery rates based on initial assessment. So, this is also what I'm also considering, no? Ganina, with our previous slide, na part of your pragmatic validity is your criterion validity, no? Your criterion validity has something to do with the prediction of the future outcomes. Okay. As part of that, the pragmatic validity, which has to predict, no, would somehow give us an intuition as a researcher, no, that at the end of our study, this will happen. At the end of our study, we will be able to create a certain plan. We are creating that plan based on the result. And this is being discussed in chapter 3. Now, your proposed output. Okay, don't forget, you have to have a proposed output for your chapter 3. Where do you, where can you do that? Based on the results of your study. What are the low? What are your focus in chapter two's results? That's being translated to chapter three's plan, program, or intervention provided by the group or the researchers. So this assesses how well an instrument correlates with an established measure. So a very good example is comparing a new diagnostic test with a gold standard. Example, you are comparing, your assessment with your clinical eye versus the golden standard in a triage area. Example, patient came in with the signs and symptoms of COVID. Part of your assessment has the following manifestations of its signs and symptoms. Now you're trying to predict with your validation that that patient might have COVID. Now we're going to correlate it with a diagnostic test and with your RT-PCR as a golden standard of test for COVID would somehow predict if they are really positive or not. Okay? So kana siya. And also, practical examples of using pragmatic validity measure, ensuring research tool are applicable in clinical setting. Okay? So basically, initial assessment tool, no? Pwede na nato siya magamit in terms of its application to nursing research. You can see that tool in the emergency room if you were assigned at the ER, no? So who among you here has been assigned to ER? Or nakabantay ba ako ninyo, no? Nga naa mo sa ER. So kung ang tumog ER, nakabantay mo atong initial assessment tool na before ang patient isa ka sa taas na ay initial assessment tool nga imong i-check kan nga mga checklist. That's a very good example of pragmatic validation. Construct validity measures how well a tool or test identifies the theoretical construct it's intended to measure, ensures theoretical soundness in ensuring research. That is why you need to have theoretical foundation of your research before you proceed with methodology as part of instrumentation. Chapter 1 comprises your theoretical foundation or theoretical background, no? That means to say that this can somehow validate and really intend what really is for the content validity. Okay? So a very good example are patients with anxiety level and also assessing the effectiveness of the nursing interventions provided. So what are theories or constructs that are related to anxiety? Probably we have to research on that. No, what theory can be anchored in this particular topic? It can be a nursing theory, perhaps, that you can identify, or probably a different theory which is related to anxiety. So we also have factor analysis, convergent and discriminant validity using theoretical framework to guide the validation process. As mentioned earlier, your theoretical framework is really important. This is also part of your book. I'm pretty sure that you're able to encounter making diagrams as part of your figure 1. Do you relate? Can you relate? When you talk about theoretical framework, it has something to do with a box composed of the theory in the top portion, sliding down to arrows, going to the variables, to the respondents, and lastly, the intervention or plan of the research. Okay? And when we talk about factor analysis, convergent and discriminant validity, this has something to do with statistical treatment, guys. There is a specific computation for this one if you do it manually. But if you're going to have the factor analysis, convergent and discriminant validity, it would be best to consult again a statistician to run and analyze the data. Okay? So this has something to do differently from getting the Cronbach alpha. Factor analysis has something to do with certain statistical tools that are being used, no, in order for us to identify the validity, and at the same time we try to analyze if it's really working or not, or if it's really effective or not with a study. Okay. So these methods and techniques that we're talking about kind of be complicated, and it needs to have um, an expert talent to do so. Okay. So tools and approaches, examples are your survey. We happen to know what is a survey. We also already differentiate what a survey versus a questionnaire is, no? Also the interviews, if we're doing quali, part of your interviews are your observation techniques, and you're also using statistical method to assess construct validity. So that's your statistics or the treatment of data. Application in nursing, that's evaluating the effectiveness of a nursing intervention. and measuring patient outcome and satisfaction, no? Part of your surveys and even interviews. Those are very good examples for the approaches of these tools. So, what's the differences and similarities? When we talk about pragmatic validity, it's focusing more into the practical applicability. Now, with construct validity, has something to do with the theoretical soundness. So, with pragmatic, it has something to do with your observation, the different situation, what is going on in that particular area. While in construct validation, has something to be proven with a theory of its assumption. Okay? So it's more into book. So more na siya, oh, it's just like school lecture being translated to RLE or related learning experience. No? The pragmatic validity focuses more into the RLE, while the construct validity focuses more into the theory or lecture. Implication, we just have to make sure that everything is in balance to make sure that the validity is being measured correctly. Now, what are the different strategies that we have to consider? We have to engage subject matter expert, of course, no expert in the level of the evaluators and even with a statistician. We also have to consider pilot testing instruments, meaning to say that we have to select then again and again, I keep on repeating for pilot, 20 participants first to answer. Those 20 participants should be excluded as part of your exclusion criteria in answering that one when it is being cascaded, no, or it's being done truly, not the pilot one. And we have to establish validity measures, no? In order for us to have this, examples would be implementing a new patient assessment tool with proven validity. Okay? So kung nursing students po ni siya, we are establishing an assessment tool for students with proven validity. And that. So description of the case study where validity measures are applied, that's a very good example of implementing validity measures. And at the same time, outcomes and lessons being learned as well. Okay. And common issues and solutions. Identifying and addressing potential validity threats. So what are these threats? Later on, we'll be talking about the different threats. I'll just have to discuss it as one in the upcoming slide. And to overcome certain challenges in validity. Just a very good examples of threats and also overcoming, how to overcome it. For example, the environment, it would somehow affect, no? The expert level, the wrong statistical treatment. What else? The respondents, only few respondents would somehow participate. So those are common issues and solutions in terms of validity assessment. So new methods and approaches in validity assessment and innovation in nursing research practices. No, so usually with technology, with the experience due to training, this would somehow emerge with the new trends right now. And in research is also being innovated with the use of different applications, right? We're using AI already. There's nothing wrong to use AI in your research, provided that it is really relevant and somehow effective and efficient. And it's also it's also related of what you are doing for research. Because there come a time, sometimes these AI would somehow generate ideas which is out of the blue, no? Wala ta kahibaw where they got this one, from what sources. Even though that you're going to instruct them, please provide a source in APA format 7th edition based on the topic. We don't know if it's really validated. Lucky are you if they can provide a link. No, so you're going to prompt again. Please provide a link for me to make sure that this is really correct. No, kung makahata gani, it's really good. What you are going to do, just simply compare it and try to validate it yourself. So what you're doing then, if you're using application, you're also doing validation. Okay, so it's part of your research. So we reviewed pragmatic measures, which we happen to know. So itong pragmatic, practical, right? Construct validation, theoretical, no? And discuss practical and theoretical application in nursing research as discussed in our previous slide. Questions so far? So far, nakasabot na ang tanan. Wala ra ta naglibog, guys. Ayaw mo kahibong ha. Ang atong gistoryahan karon is more about the questionnaire and instrumentation lang jud. Okay? That's our main topic. Lesson 6 to 10 focuses more into validation and having it being reliable with our research. Okay, let's go with session number 8. So if you would like to have a bladder break, you can bring your cell phone in the comfort room, okay? But make sure that you're listening attentively. I will be also randomly checking your notes. I will be giving 50 points for that for your notebook. Okay, I will be checking that one once we meet with our face-to-face schedule. So if no notebook, wala. Okay, meaning to say that you're taking down notes and you're really listening of what I'm talking about. For pre-test and post-test, I'll try to administer within the P1 session. Okay, basta I would really like to get your SAS output later by 12:30 in the afternoon. So sensitivity and specificity. No, so this is part of the lesson. We are trying to understand sensitivity and specificity in nursing research as part of our discussion in the upcoming slide. We also have to consider the critical for accurate diagnostic testing and patient care. Okay. So what do you mean by sensitivity? When we talk about sensitivity, this is the ability of the test to correctly identify those with a disease. These are true positive. Again, sensitivity, this is the ability to test correctly with the disease. High sensitivity is crucial for early disease detection. So example in nursing research, we identify patients with early stage infections, screening for chronic diseases, because we are considering and we are trying to identify these patients who have infection are really having that kind of disease. So say for example, cough, no? Persistent cough for how many days, no? At the same time, hemoptysis, no? Na siya play mga dugo. And at the same time, the findings of the X-ray, when we do screening, it seems like that the presentation is more about tuberculosis. So this is something to do with the test to correctly identify with the right disease that we are looking into. While specificity has something to do with the ability to test to correctly identify those without the disease. So we are high specificity is crucial for confirming the absence of diseases. By the way, guys, what we're talking about with this lesson is more into experimental designs. Okay. So we are into the context of experimentation. Another thing, another example, confirming patients without an infection and ruling out false positive and chronic disease screening. Example, the patient came in the hospital with a right lower quadrant pain. So the doctor would somehow consider appendicitis as part of his initial diagnosis. Would it turn out that the patient's urine analysis is really negative and there is no indication of having appendicitis. Okay. However, with the manifestation of the patient, it's just an excruciating pain in the lower right. Okay. But you happen to know that the patient is female. So when it turned out, no, it was being ruled out due to false positive that the patient has appendicitis. With the upcoming test, it was identified that the patient might have pelvic inflammatory disease. PID di ay siya niran lang sa ihang right lower quadrant ug naganda-gandagan na di ay ito sa ihang puson nga area and also in the pelvis. No. So mo na siya. So usually some of the initial diagnosis of the doctor can be proven wrong. That's how you identify specificity, having no disease at all, which the ability to test to correctly identify without that disease, but giving out, rule out diagnostic findings. Okay? Okay. Again, true positive, what is this? Correctly identified as having the disease. True negative, correctly identified that they do not have the disease. So this ensures accuracy and reliability in patient diagnosis, reducing the risk of misdiagnosis and unnecessary treatment. Okay, that's the importance of diagnostic testing. So sometimes, guys, doctors would really work hand in hand with other healthcare team. It's not just with the nurses, as you can see in the nurses station, but you also have to consider other healthcare members. And who are these? These are your lab technicians or laboratory personnel, your medical technologists. You also have your pharmacists with you. At the same time, your OTPT, at the same time, your dietitian, no? Or the dietetics group. Sila po na, no? And for this good example, it has something to do with a diagnosis correlating as to the laboratory result of the patient, right? So if the doctor thinks positively, he can identify no that that disease is really correct by considering some diagnostic test that is being run for the patient. Okay? But kung wala ganun kwarta ang patient, there might be true negative, correctly identified as not having the disease because they couldn't correlate it due to the fact or the factor that the patient couldn't afford the diagnostic exams. So probably doctors will somehow just give antibiotics or initial treatment, no? But it will be best managed on diagnostics. So what is our role as a nurse? What's the implication in nursing? We have to know the reason why the patient was not able to pay the diagnostic bills, right? As part of our communication skills. No, that's our role. Unless mo siyang hubayhan, kung kwarta laban, no? Pero bati po, no, we do dole out our patient. We don't teach them how to be independent. It's very important that they also have to be independent, not just with their well-being, but also financially. Step-by-step guide. No? So identify all positive test results. Confirm which of these are true positives through additional testing. No? So screening, daghang tagpuan, no? For example, a patient came in inside the ER with just a complaint of difficulty in breathing. It turned out the nakagsakit ang patient. There are a lot of diseases already because the patient is being screened aside from the difficulty in breathing, which is just your x-ray. Patient was placed into CT scan. It found out that there are lots of tumors already, or probably a patient already has a cancer. Okay, so that's how we're trying to consider true positives. No, we're looking into consideration what we are not expecting, and it's really expected to happen due to diagnostic tests. Okay, identify all negative test results. Confirm which of these are true negatives through additional testing. Taas man kay siyang WBC, pero wala man gihilanat ang pasyente. No, kana. Then screening for a specific infection and confirming true negatives. B, iubo man ninyo, yung taas kay WBC, iubo man. Why don't we have the kuan, sputum exam? No? So the doctor would somehow order that to the chart and then the nurse will facilitate. And it turned out that it's positive with a sputum exam, no, positive with tuberculosis. And then it was sent out, no, then again, just a confirmatory, manigurado pa dyan ang doctor, gene expert, which would cost almost 20,000 for the patient to pay. No, kana siya. So mana siya guys, ang ato ang identifiable measures through experimentation. Always remember, guys, we are not saying that we are trying to experiment our patients, but we are doing our best in order for us to give the quality health service and care for them. That is why at the very beginning of their admission, once they step in at the ERA and wanted to be admitted based on their decision, a consent is given. Part of the, is that right? Was this explained with your ER clinical instructor who handled you at that time? Once the consent is served, it's the doctor's responsibility to explain everything if the patient needs to be admitted and the pros and cons of admission. Aside from that, the attestation of care is being secured by the nurse. With the attestation of care, it explains everything, particularly with the patient's right, access to care and continuity of care, and even some of the assessments done to the patient as part of the international patient safety goals no, in the hospital. And if the patient agrees into it, the patient affixes his or her signature if they're able to do so. A representative is there who is a primary next of kin. If your patient is comatose or doesn't have any or has mental illness, it can be less than 18 years old, no, who is a pediatric patient who couldn't somehow decide for them own or for themselves, no? So that's part of it. Now, whatever the doctor is doing in the hospital, you agree on what we are doing as part of your treatment. But if you're going to look at the research side of that, it's more into doing experimentation as to what's best for our patient's condition, which doesn't harm our patient. No. Okay. So we need to balance sensitivity and specificity and diagnostic testing. Okay. And of course, how to balance? Just kuan. Just check it, no? Balancing it by rechecking, assessing, and then rechecking again. That's how we do it. Really pwede no na our patient will be charged so many diagnostic tests which are really irrelevant of the condition of the patient, no? Sir, what do you mean by that? So say for example, ang patient ilan na imo siyang ipa-MRI, imo siyang ipa-CT scan, imong ipa-ultrasound, naghihilan na tra ang patient. Batik po na, guys, no? I know, no, mas yung mga doctor na mag-ingon ana, okay? Because they also know what they're doing and they're also experts in their field as physicians, okay? So we need to have trade-offs in consideration as well for balancing, no? Sensitivity and specificity. High sensitivity can lead to more false positive, while high specificity can lead to more false negative. So in order for us to balance, we have to adjust the threshold based on the clinical needs and using complementary tests to improve accuracy. Okay, these complementary tests are available, but the doctors must select what is really right for the patient. Okay, understanding the limitations of sensitivity and specificity and common errors in interpreting results. No, however, doctors are already know no the normal values of the laboratories. And they're also being guided with certain references being provided by the laboratory. As you can see in the patient's chart, if you are in the lab reports or in the lab sheets, you can see there that if there is an example, a CBC result, you can see there the normal parameters as to where the result would somehow fit. No. And to ensure accurate result, there should be best practices for accurate testing, strategies for improving test reliability. So innovations and trends, because of technology, reagents available for diagnostic testing, no? At the same time, training coming from the medical technologists, no, by continuing their education. This has something to do with its innovation and trends nowadays. Okay. Development can improve patient care, we nurses must know as well how to properly cascade and communicate with the other healthcare team. We also have to have an idea what's going on, no? If these are being run. And if there are results given, nurses should know how to interpret it because we are trying to anticipate what would be the medical intervention be provided by the doctor once they can see some results which are abnormal. No? Okay, hold on. Okay. So, implementing best practices for diagnostic accuracy, case examples of sensitivity and specificity in action. So, in real world scenarios and tips for effective testing, it has something to do with the reliability of the machines as well. No, practical application that what you see in the laboratory would somehow, um, of course, too, in terms of resources, medical technologists should ready the machines all the time. They also know what the threshold of the machine as to how many tests can be accommodated in a particular day for us to conserve it. And of course, proper calibration of the machine so that they will not be able to produce wrong data. So we just reviewed sensitivity and specificity, and we'll be able to at least compute true positives and true negatives by identifying certain situations. Okay. questions so far? Kaya pa ninyo? Kaya pa, uy. Okay? We still have two more lessons. For the after we have our discussion, we will be opening the floor for consultation of your research. Okay, or if there are no consultation, I will be randomly calling one by one, and that's part of recitation. No, I'll give 10 points if you can provide me updates with your paperworks. Okay, or if not, you can open up with your paper for consultation purposes. Okay, or even share it to the screen, no, so everyone can see it. So let's talk about the threats. Okay, so understanding threats to internal and external validity in nursing research. So it has something to do with ensuring the accuracy and applicability of research findings. Learning outcome focuses on discussing internal and external threats to validity. And validity refers to the accuracy and trustworthiness of research findings, meaning to say that if it's really accurate, no, guys, we're talking about research now, no? Also with the instrument, no? So most likely the entire research or most likely the instrument, no? So nalang ko yung mga examples ana, you might be confused niya ba? Okay? Has something to do with accuracy, meaning to say that it was well validated, it is really reliable, and trustworthiness that at the end of the study, it will somehow produce a good result. Would either be negative or positive. Okay. And we have to ensure that research results are credible enough and applicable. So types of validity that includes here your internal validity and external validity. Later on, we'll be talking what these validity all about. So internal validity, it has something to do, literally it refers to the extent to which the study accurately measures the effect of the independent variable on the dependent variable. This is crucial for establishing causal relationship in research. What do you mean by causal relationship? When we're looking into two variables and you're trying to see the relationship between the two. So have you noticed in your statement of the problem, there is no significant relationship of the profile and also the job satisfaction of nurses in SW Med. There is no significant relationship of job satisfaction and performance of nurses in SWMED. That's what we're trying to establish, no, with its causal relationship. And at the same time, the effects to independent variable and dependent variable. When we talk about the effects to the independent variable, your dependent variable is being manipulated and has something to do with its effect with the independent variable. Example, with the staff's job satisfaction, does it mean that with performance, it will somehow affect the job satisfaction of the patient? The performance can be considered as dependent variable because if the performance is low and the performance is high, what will happen to job satisfaction? So we are trying to study the effect to the independent variable based on the second variable that we are looking into. So type of threats that are being considered are history, maturation testing, instrumentation. You also have your statistical regression, selection bias, and experimental mortality. So when we say about history, we talk about what is going on before. No, so usually if you are going to have a study and what was being studied before in the past can be a factor of the internal threat of your variable. Another thing, no, is your maturation. When we talk about your maturation, it has something to do with involvedness, no, of the participant over time who are not related to the treatment. Okay, so say for example, no, in a longitudinal study of the, say for example, impact of reading intervention of, say for example, preschool students, okay, improvements of their reading skills may naturally occur if they mature, right? Naturally, rather than due to providing interventions. What do you mean by interventions? Imong gi atagan og saktong lugar, saktong adlaw, saktong schedule, in terms of having them learn by them own in terms of reading based on what the teacher is explaining. Okay, so naturally, time, no? Ang time mo'y mag-control niya na mo mature jud ang bata in terms of the development of the brain as well. Then, you also have your testing. So, meaning to say, kanang mag-test ta. So, say for example, taking a test, no? Influences the performance of the participant. So, example, sa study, no? You're trying to measure the study skills, particularly in a certain lesson, particularly in a certain workshop. Then your participants may perform better on a post-test. Why? Simply because they already taken the similar test during the pre-test. Okay? It doesn't mean that you have lecture or you have workshop that they do good. But with your testing, it can be a threat because you are just repeating the pre-test given before. No. And then you have your instrumentation. This refers to the changes, no, of the tool. So say for example, at the very beginning, no, the money pilot testing. But when you try to get it to your participant, when you go to your actual participant for the actual data gathering, you are changing the tool again. Or then again, the tool some items are obliterated or being changed. No, some participants were able to answer 10 items, other participants were able to answer only 8 because you change it, no? Because there was one participant who mentioned that the tool is not really that good in terms of its validity content, no? Okay. Statistical regression. When we talk about statistical regression, this is something to do with the statistics that you are using. Okay. In terms of statistics, no, we're able to consider the different types of statistics being used to treat the data, but it turned out that the statistical tool is not that correct, no? Or probably it's just too simple to treat, but the statistician was able to use sophisticated or complex statistical treatment for regression. And that, okay? Then selection bias. When we talk about selection bias, it has something to do with systematic no differences. When we talk about systematic differences, no, participant and imong respondent in different group that could somehow affect the outcome. So say for example, no, mag-study ka on the effects of new diet to your patient. If the participant is really health conscious about his or her diet, more likely ang imuhang result would somehow be biased rather than those participants that you are trying to select who are not health conscious at all. These volunteers who are not conscious at all. Why? Because if they're health conscious, sigurado ko no na they're really into the effects of the diet to their health. So most likely wala jud siya. Okay? And then experimental mortality and sa man ni siya. Mawa og kalit ang imuhang patient, imuhang respondent, no? So say for example, you're already giving him or her um a questionnaire. But it turned out in the middle of answering, the patient withdrawn. No? Ay, ang padayon ani uy nagkapati grabe naman yung mga pangutana di naman ko confident mo answer ani or it seems like that murag grabe naman siya sa akong privacy ana. Okay, so that's part of experimental mortality. Mawala siya no, sayang kaayos tanan ang imuhang na kuha nga participant. Especially that if you have a research which your participants no is really kuan kanang it's really scarce. Okay? Kana siya. Randomization. Okay, you're doing randomization in a way that involves this is already no strategies no to decrease threat or try to mitigate. Internal threats can be the same as external threats. Same with examples of external threat. Pari-pareho ra jud siya. So I'm trying to discuss it one by one. Kimo. It would somehow turn out to the next slide that we will be discussing. Then again, kung may randomization, for example, no, you are trying to assign participant to a different group. Example, treatment and control. You have to make sure, you know, that in this process, no, each participant or respondent has an equal chance of being assigned. So it's very important that you have random sampling or quota sampling padarapod siya. Okay? Another thing is your control group. When we talk about a control group, it has something to do with the group of participants or your respondents, no? And does not receive, okay, experimental treatment, okay? So they are being treated in terms of otherwise treated with identical, no, experimentation group. What do you mean by this one? Example, no? Sa study, educational study, you are looking into, say for example, no, impact of teaching methods, no, of one group of nursing students sa community, okay? Using the new method of the experimental group. The other group is taught using the traditional group or the clinical instructor. The other one is being taught by the new way of doing it, no? The innovative way of doing it, the innovation. And we're trying to compare the performance of both group, no? And we're trying to isolate as well the effects of the new teaching method on this particular control group. So which has an effect? The traditional one or the new innovation, the innovative one, the one which is being taught by the new generations of CIs. Okay? Now, when we talk about blinding, this involves concealing information to the participant. That means to say, no, that researchers and even participants don't know, no, that they are well manipulated. So, pwede ni siya single or double. Kung may kaug single, example, participants do not know whether they're receiving a treatment or placebo. Okay? And when we talk about double blind, kaning imong participant or respondents or nor ang imong researchers know who is receiving the treatment or placebo or wa sila nakahibaw kung naka-receive pa sa placebo ang patient or wala. Alright? So say for example, sa hospital, ang patient, sige jud siya, gireklamong pain, nga moingon ang doctor, no nga, okay, kanang gailan na siya o kanang NSS. Ayaw lang saba nga, dili ko siya kuanhan. Placebo lang ihatag, NSS, 3 ml now, IBTP. Okay, mo man na usually nang i-order. So may na, ang nurse, ma'am, maghatag ko ma'am ha, muturo ko sa imuhang IV. So nanguna-una ang patient, no? Na that is a pain reliever. So afterwards, maghatag, murag, due to the control of the mind of the patient, mawa ang pain. Mo na siya ang blinding. Okay? So, then again, if you're going to give tramadol for pain, mawala jud siya because of the medication. But of course, there are times that doctors will somehow assess the patient might be malingering or tendency is the patient might be um uh the patient is just waiting for the drug to be administered, no? Because it has side effects, no? Pwede siyang murag mahay giving tramadol. So possible, no? She can act having pain or she can role play having pain. Okay? It depends on the situation. All right? That's blinding. And we talk about standardized procedure, we are talking about the involvement of consistent practice, standardized practice, okay? Consistent na dapat sa mga protocol all throughout the study in order for us to make sure that our respondents are well treated equally. All right? So if you have your ethics, part of your discussion is about this one, no? Kanang mga blinding, kung ganun kag experimentation or experimental design, and also standardized procedure, kung sa saktong procedure sa institution, not just in school, but also to the environment or locale of your study. So far, did you get the examples? Okay. Next is external validity. External validity is something to the extent to which research findings can be generalized to other settings, probably the population and time. So this ensures the applicability of research result in the real world setting. Okay. So these findings are generalized, no, being specified in the setting of population and times. And at the same time, the practical. Possibly this can be no validation of pragmatic validity is just the same as with the real world experience or setting. So a very good example of external threat, that is your population validity. You also have your ecological validity and also your temporal validity. So what is population? Kaning population, example, a study, no, which has an effectiveness of butang tag educational program in conduction with a sample of high achieving students, no, high achieving students meaning to say ang mga bright, no, aning school, and the results may not be generalizable. However, we cannot somehow determine na if these students who have high achieving students, if you are going to have them with a new subject, do they have an average or somehow low achievement ana nga subject, no? Because we cannot conclude, no, that the effectiveness, no, of the educational program of the school would really matter into the enrollment of that subject, particularly in the major. Okay? Or siguro, right, should kayo siya nga student among all the population, siya number one. And when she tried to get nursing, we don't know if she can really succeed with a high grade or a low grade, no? It will really depend. But if the student is really that intelligent, inborn dyan siya, na nandiyo siya yung ana, no? Nga talent, then again, we can somehow assume na pwede siya makapasar. So that means to say that we refer to the extent, no, of which the study result is being generalized with the entire population. Okay, and it's being drawn with a sample. So what our sample in our example was the um, high achieve high achieving student. Okay, katong bright kaayo. Now, when we talk about ecological validity, ecological has something to do with the extent of the surroundings, no, with the environment that can affect, no, the the study. And somehow, this would be a threat, no? Why? Because sometimes it can be controlled and sometimes it can be manipulated. So if it's, say for example, ang kainiton, okay? So for example, ang patient nimo, no? The temperature of the patient would really depend into the surroundings of the patient. If you are going to adjust, no, the room temperature by increasing the AC, no, or having it full blast into cool setting, tendency the temperature of the patient might drop. But if it's too hot that the patient is being admitted with just an electric fan, no, or just ventilation in the ward, tendency your patient might be experiencing fever, might be febrile sometimes. Okay, so that is why it's very important to consider as well, no, the manipulation of ecological validity. Next is temporal validity. So when we talk about temporal validity, this is something to do with the extent, no, in which the results of the study can be generalized with different times, no. So a threat or temporal validity has something to do with the findings that are more specific to the period of time that the study was conducted. Okay, so say for example, no, nag-study ka sa imuhang patient sa iyang behavior on that particular day, then you are looking into the behavior of the patient during admission at the end of the day, at the end of the admission, no? So say for example, admitted siya, ang iyang behavior at that time is totally different. The patient behaves differently by showing no interest of what he or she is doing. Patient is not communicative at all. But as the day goes by, no, we are trying to consider as well, no, the recovery of the patient. Maybe the patient was already able to perform the activities of daily living at that time. The behavior of the patient change in which the patient would really communicate with the healthcare practitioner due to the elevation of the manifestations of signs and symptoms of the disease. Okay, so that can be considered as well, no, and it's generalized upon. So how to decrease the threats? Representative sampling, the same thing as randomization. And we have to relate it with realistic setting, for our patients, for the respondents. We have to make sure that we control the threats. And of course, replication of studies, because these studies in the past are already been proven. We can somehow replicate the studies in such a way that we are anchoring our study for good foundation, particularly with its relatedness and trustworthiness. Okay, so when we talk about history, these are events outside the study that affects participant responses. This is just more into kuan guys sa kanang summary. Maturation, changes in participants over time that affects outcome. Testing has the effect of taking a test on the outcomes of taking the second test. Instrumentation, changes of the instrument, no? Katong gi-change na tong kalit. Statistical regression, extreme scores towards the average on retesting. Selection bias and systematic differences in characteristic on selected participant. And experimental mortality has something to do with the loss of participants across the study groups. Okay, so I think we're able to tackle this one and give examples in the previous slide. No, so the extent to which findings can be generalized to the population from which the sample was drawn, that's your population validity. This is also a summary. Ecological validity, the extent to which study findings can be generalized to other setting. And temporal validity has the extent to which study findings can be generalized to other times. So another thing that we're also been discussed, just to summarize, randomization, control groups, blinding, and standardized procedure. Representative sampling as part of your sampling method, realistic setting, bringing patient to realistic situation, and replication of the studies, particularly with the previous studies that are being anchored to your study. So the challenge of maximizing both internal and external validity is that situations where one may need to be prioritized over the other. So there come a time that we are considering internal versus external. It would not be, it can be possible if we can somehow do both, but it will be best that we can start with internal and then next is the external validity. All right. So common issues lang nato ani is most likely the time, the competence of the researcher. We also have the too much statistical power, the low compliance or retrieval rate, no, due to population mortality. Another thing is the sample size is too low, no? Ubos kay siya sample size, no? Those are the common issues. What's the main solution for that? Increase the population size. You have to correlate how many respondents should answer. Out of 1,000 nursing students for second year students, no, if they are your population or your respondent, how many are you going to get from that sample? So you can use your Sloven's formula in computing and also your Mark and Kenji table of respondents, and you can even consider total enumeration, meaning to say that you're going to get all the second year students. However, there should be an exclusion and inclusion criteria whether they wanted to participate in your study or not. Okay. So just to review, which is an internal and external validity that we've discussed. And we also have the threats and even the strategies, how to reduce or mitigate them. Questions so far? Kaya pa? Kaginhawa pa ang tanan? Okay. So sakto ra jud no mo enta og mga alas 11 siguro no if we will be able to hit that time. And then we'll be open for consultation. So lesson 10, threats to constructs and statistical conclusion validity. Just the same thing, no? Threats and internal and external validity. We have to understand threats to construct and statistical conclusion validity in nursing, ensuring that there should be accurate and reliable research findings, and we need to focus on describing the threats, no? Threats towards construct and statistical validity. So, validity refers to the accuracy and trustworthiness of research findings, okay? And it ensures that research results are credible and applicable. So this includes construct validity and statistical conclusion validity. When you talk about construct validity, this has to refer with a degree to which test measure what it claims to be measuring, ensures the theoretical soundness of the research. So meaning to say that with your construct, it has something to do, as mentioned in the previous line, has something to do with theoretical soundness, that it should be anchored with certain literatures and certain theories coming from book and other resources of your reference. A very good example is inadequate implication of construct, construct confounding, mono method bias, confounding construct with level of construct. No, clear definition of construct using multiple method, ensuring theoretical consistency. So we will be talking this one by one. So statistical conclusion has a validity refers to the degree to which conclusion about the relationship among variable based on the data are correct. And you have to ensure that the research findings are accurate and reliable. So when we talk about statistical conclusion validity has something to do with running into statistics. We're looking as well with its relationship. That is why we are doing there Pearson R, the testing, no? Among variables based on the data that is being generated. For this one, it has something to do with the utilization of stat. Okay, so low statistical power, what do you mean by this one? Low ang iyahang na-generate na number. It's because probably with a very low number of respondents who answered the survey, okay, it did not generate data. Another thing is violated assumption of a statistical test. Say, for example, looking into the relationship in your statement of the problem, there is no significant relationship, no, but it turned out that it has a significant relationship. That means to say that there's something wrong, no, something wrong with the statistical treatment, and we have to consider by rerunning it with the SPSS, or the if it's really the number that it ran, no? Tendency is you have to focus more into your explanation as to why it has a significant relationship rather than no significant relationship at all. Part of your null hypothesis. Phishing and error rate, meaning to say that randomly, as you can see, no, it seems like that the data are being manipulated, part of which are unreliable measure due to biases. Okay, so some of the data, not the entire data, but only a few, were able to have a different scoring. Most of the scoring, part of your predictability validation, kay consistent yun siya, no? Not significant, not significant. But there come a time that there is one particular item has a significant relationship, no? Probably it turned out with its causal effect has a significant relationship. So that can be a good problem. You know, it can be a threat. Why? Because it can produce bias to your results. So best thing, again, increase sample size. Make sure that the statistician will be able to know what statistical tests can be done, and controlling for multiple comparison using reliable measurement instrument that are well validated in terms of content, no? Balik na po tatong content validation, index, and even the scale, no? So dapat ingunan na because it would really show us guys some anomalies, no, in our data once it is being run in the statistics if we are not doing the right procedure and if it's not standardized. Inadequate explication of constructs. This has something to do with the failure to clearly define the construct being measured. So mixing two constructs that should be measured separately. So no, that's more into the construct confounding, meaning to say that say for example, you are considering this particular item, that the thought of this item is more into job satisfaction, but you are mixing it together with another compound which should be measured separately, or it should be on another item. Job satisfaction and performance, imong giusa ang question. So job satisfaction and performance, no, that can be a confounding effect, no, for your construct validity thread. Another thing is your mono-method bias, reliance on a single method to measure a construct, meaning to say that if you are do experimental designs, ang imong gibuhat is, say for example, no, you're looking into the performance of those students who really got low grades during P1 and somebody who's going to mentor them for those students who got the highest grade, the top, the top five, no? And it turned out na the only single method that is being used for the construct is more into on some type of mentoring. Siguro, FGD lang or focus group discussion. There are five who's in the lowest and one who actually serves as a leader for the highest. And it turned out that the only thing is more in the only thing that he or she is doing in terms of increasing the performance is through open discussion. Okay, supposedly if part of mentoring, no, it's more into coaching, it's more into probably giving some ideas on how to attack in answering test questions. Okay, so that can be a part of threat as well. Another thing is confounding construct with levels of constructs. Mistaking levels of a construct for the construct itself. Meaning to say na wrong ang imuhang nakuha nga construct. No? The particular variable that you are studying is wrong due to the fact that your instrument are not reliable at all. Wa siya nagkatugma tanan. Kay lagi, it did not went through validation and reliability testing. So not enough data to detect a true effect. That's your low statistical power. And when you talk about violated assumption of statistical tests, you are doing incorrect, no? Use of statistical testing leading to invalid conclusion. So usually what will happen to this one? Sometimes if the statistician is not really um into the research in the field of nursing, no? Or he or she is in the field of administration, there's a big chance that when he tried to run it to the SPSS, the values are not correct anymore. Okay. And of course, phishing and error rate problem in a reliable measure has something to do with multiple analysis increases the chance of finding false positives. Too much, no? Too much analysis due to too much item. The item did not go through content validity and was not evaluated by expert. Nagpatuyang lang ang mga students, no? Nang butang din na sa usa ka variable na siya 50 ka questions, no? That is why, no? It would somehow increase the chance of finding false positive or false data at all. At the same time, using measurement tools that do not consistently produce accurate results. Okay, unreliable measures. So, for example, you're looking into the testing the relationship. Instead of using the Pearson R, regression model is being used during the statistical treatment. No, instead of predictability studies, instead of using regression, Pearson R or causal relationship is being used. Ano siya? Mabaylo-baylo na. Okay. So panels can somehow detect on that during your final defense. So they might be considering that as part of the records of the proceeding that you have to work on in order for it to be changed, no, and the data will be enhanced. Then factor analysis, convergent and discriminant validity, using theoretical framework to guide the validation process. The same thing, complicated statistical treatment as much as necessary with the expertise of the statistician and using theoretical foundation framework in order for us to make sure that it is a good foundation, which leads to reliability and trustworthiness, okay, of the construct. So proper statistical techniques, proper SPSS handling, power analysis, no, controlling for confounding variables, making sure that you can identify already what is your dependent and independent variable at the very beginning of your study. No, so if there are two variables that you will be studying, the panelists would really ask which one is independent, which one is dependent. No, but anyway, you've already done proposing your output. So of course, you already know your study all about. So challenge of maximizing both construct and statistical conclusion validity situations where one may need to be prioritized over the other. That means to say that we have to take it one by one for trade-off consideration. Okay, and both should be balanced. The same thing as internal and external validity. Your construct and statistical conclusion validity must be balanced at all times. Okay. Okay. So common issues lang siguro na to ani is to make sure no na we can find the right person who can treat statistically your data. Another thing is the training of students on how to interpret results coming from quantifiable measure data, part of quantitative study, no? And also how to make sure in terms of the um, discussion of the interpretation of results of the study. That's very important as well. So that is why with your book, your review of related literature should not be less than 10 pages, no, your RRL, because your RRL that will be used in chapter 2 that will anchor your discussion on the statistics given by the statistician, and you are going to support it with literature aside from the observations and situations that you've encountered in your respective institution. Okay? So that's also very important. That is why with your review of related literature, it has a literature because it can be used during the interpretation and results discussion. So we reviewed construct and statistical conclusion validity, and we've been able to identify as well threats and how to minimize or mitigate them. Questions so far? Any questions? So if none, okay, I will be stopping the recording. Okay, so